Friends, I am Dr. Surajit Ghosh. Welcome to my channel, Dr. Ghosh Presents. Top 10 homeopathic remedies for toothache. What is toothache? Due to infection of tooth or gum or dental caries or injury and extraction of tooth, when attached nerves get inflamed and pain is felt, we call it toothache. Sometimes pain of different places are felt like toothache. This is called referred pain. For example, temporomandibular joint. Look at this picture. This joint is called temporomandibular joint, which makes our jaw moving. It is a type of hinge and gliding joint and possibly the most used joint in our body. Trigeminal or occipital neuralgic pain, earache, pain of sinusitis, even pain of heart disease or lung cancer may create toothache. Please note this peculiarity. Toothache may come from this different type of ailments also. Two TMJ joints situated on either side. One is this side, another is opposite side. Two temporomandibular joints situated on either side of head are most used bony joint. It controls movement of mandible and lower jaw and are situated just in front of ears. Just in front of our ears. Here is ears, that in front of that. What are the structures of a tooth? The structures of tooth, you see, if you grossly analyze, the first portion is caries, then neck, this is neck, from this to this neck, and then root, this portion, root. It is gross divisions, and if you go a bit more finer, then first portion just above the teeth is called enamel, then inside the teeth is dentin, then pulp. After pulp comes gum, then root canal. Present days root canal therapy is done by removing this portion, root canal, then bone, finally cementum. Just more uppermost layer of the tooth. What are the types of tooth and their numbers? Tooths are actually, 16 into 2, that is 32. Incisors 8, canines 4, premolar 8, molar 12. These are total number of teeth, that is 32. Upper 16, lower 16, and each quadrant 8, that is upper left 8, lower left 8, upper right 8, lower right 8, and these incisors looks like this, canines look like this, premolar look like this, premolar look like this, and molar look like this. So this is in this way we have got 32 or 16 pairs of tooth. What is the cause of toothache? The main reason of pain in the tooth is inflammation of the central part of tooth called pulp. Already we have defined pulp. There are many nerve endings in the pulp which are very sensitive. When infection or injury or caries creates irritation and inflammation in the pulp, we feel pain. That is, pain means inflammation or irritation of the pulp. Here the pulp region is again seen here. This is pulp. Further, a pair of central cranial nerves named vagus nerves emitting from the brain runs downward beside the jaw to touch lung and heart. As such, ailments of lungs and heart are also felt as toothache. The course of this particular cranial nerve, vagus, this course passes beside lungs and heart. So pain of lungs and heart also referred as a tooth pain. This is a very interesting phenomena to note that not all toothache are real toothache. Some toothache are actually inflammations of lung or inflammation of the heart. What are other symptoms of toothache? Number 1, difficulties in drinking, eating, speaking. 2, excessive sense of coldness, hotness. 3, bleeding or other discharge from teeth and gums. Swelling and pain in gums and jaws. Pain may be pulsating, burning type or electric current like. Fever. Halitosis. Halitosis means actually foul odor in breath. While noting sign symptoms from the patient, doctor has to ascertain whether the pain relates to tooth gum or it is a referred pain. That is most important thing. That is, pain actually relates to the other organ. Otherwise, there would remain fallacy in the root. This root means not tooth, the root of the problem. If a doctor cannot differentiate between a true tooth pain and referred tooth pain, he will not be able to treat the patient correctly. Referred pains, temporomandibular disorder, sinusitis, ear infection, trigeminal or occipital neuralgia, malady of lungs or heart. So not only malady of lungs and hearts, other things are also there which may not be directly related to tooth, such as temporomandibular joint disorder. Temporomandibular joint disorder means not tooth disorder. Sinusitis, different type. Ear infection, different type. Trigeminal occipital neuralgia, different type. But all this can cause referred pain of tooth. Some picture, please note these things. Why does halitosis occur? That's a very important thing. Many person wants to know why halitosis occur, why bad breath comes. Bad breath is a very disturbing symptoms. It's an obstacle to establish social relation. Reasons of bad breath are varied. As per survey, 85% of such symptoms relate to tooth or mouth problems. Most of these arise from tooth debris left in mouth, bacteria and saliva. That is dental plaque, gingivitis, periodontitis. Space between the tooth and the gum is called periodontal space. Space between tooth and gum. This is gum, this is tooth. There is small space between this tooth and gum. It is called periodontal space. Another reason for bad breath is xerostomia, dry mouth, where saliva secretion in mouth is stopped and bacterial growth increases greatly. Our mouth is always, when inside the mouth, is always moist because saliva is constantly secreting, and that saliva is some sort of antibacterial effect has got. Naturally, saliva controls bacterial growth in mouth. Following diseases bring about xerostomia: diabetes, Zorens syndrome, radio or chemotherapy, drugs like anti-hypertensive drug, antidepressant drugs, antipsychotics and diuretics. These drugs means all the drugs related to modern allopathic medicines, not other systems. Now, plaque. I have used the term plaque here. Now, what is plaque actually? The sticky film of bacteria that constantly forms on tooth is called plaque. If not cleared daily, this solidifies and start tooth decay, then caries and finally destruct the tooth. That is, this plaque is the most important thing to remove every day during toothbrush, as a toothbrush. The plaque is shown here. This is plaque, just at the junction of tooth and gum. Sticky, thin film-like substance, which is, to start with, is very simple to remove, but in course of time it converted into stone-like things. How to get rid of halitosis and keep teeth intact for long? Number 1, floss before brushing. Very difficult thing. I do not think that everyone does it. Most of us just brush the teeth, but floss is very important thing. Wash or rinse mouth after taking any drinks or food. That is very, very important. You take any food or drink, you have to wash or rinse your mouth. Then massage teeth and gum with water and fingers carefully. This number 2 is very, very important. It can be done if you are conscious enough. And if you do this thing, the profit is that your teeth will be intact till death. 3. Brush teeth twice a day, after lunch, after dinner. You may miss the first one, but to miss brushing after dinner amounts to a blunder, because aim to clean the plaque between gum and enamel of the teeth. Actually, why we brush teeth? This is the aim. The aim to clean the plaque between the gum and enamel. It is the most important thing. Now, especially after taking any sticky sweet, there is another warning. Sticky sweet, namely sticky sweet, this is a card, rasagulla, this type of, whether there is thick fluid-like substance. Meat, another very important thing that damage tooth. Card, chocolate, ice cream, cake, tea, coffee, or any other drink. Rinse your mouth very carefully. This is after taking all these things. After taking all these things, you have to rinse your mouth. Number 5, if you are really serious about your teeth, take care to have dental checkup twice a year. This is a very, very, very important thing, but very few of us used to do it, because we generally do not go to doctor unless we are obliged to. That is, we are forced to. I am okay, but I am going to check up just my tooth twice a year. It seldom occurs in our society, because we are not trained in this way from our childhood days. And childhood days practice makes the practice thing which goes lifelong. But if you can do it, if you can check up twice a year your teeth by a dental expert, I am sure your teeth will be better. What is tooth decay? In most countries of the world, tooth decay is second most common disease, the first being common cold. This is another information. Common cold is the most common disease, then common disease tooth decay. Main cause of tooth decay is tooth decay. Main cause of toothache is tooth decay. Plaque, sugar from foods and other carbs conjointly produce acid. Acid decays the enamels of the tooth. Failure to maintain dental hygiene is the reason of it. That is, plaque, sugar and other carbs jointly produce some acid which decays the enamel of the tooth, and enamel of the tooth, when gone, the tooth becomes eroded. There is caries starts, and ultimately that tooth will fall. What is the wisdom tooth? The third molar tooth that are erupted in late stage of adults are called wisdom teeth. They are generally 4 in number, but maybe less or more. 4 means in 4 quadrant: upper left, upper right, lower right. One each wisdom teeth. When these teeth erupt, gum is very much hard, so eruption often takes a tortuous way, very painful, which gives a lot of pain. So sometimes these teeth are extracted out by dental surgeons. The patient suffer from so severe pain that doctor used to do this. This tooth is not so much important for biological purposes. When to consult a doctor? Number 1, when face or jaws are swollen. First picture. When there is chest pain or breathing difficulty, vertigo, maybe wheezing sounds in chest, disturbing dull cough or hemoptysis, bleeding from the mouth is there. Dyspnea or trouble in swallowing. You are feeling breathing difficulty when swallowing. These are the point when you must consult doctor. How to manage dental problem? In total management of a dental problem, the role of dental surgeon is indispensable. You cannot go without a dental surgeon. This is must. Whenever a particular problem goes outside the purview of remedial treatment, none can do without a dental surgeon. Up to certain level, remedial treatment, that is treatment by remedy or other medicine, is possible. But beyond that, it goes outside all remedial treatment. All homeopathic physicians must appreciate this fact. Whether you are a homeopath or you are a doctor of biochemics or tissue salt therapy, you must remind this, that you cannot do everything what a dental surgeon can do. Scaling, filling, crowning, root canal therapy, root extraction, bridging, veneering, implanting, denturing are now extensively performed by a dental surgeon, who very often call him or herself an engineer, an artist, and a doctor in one package. And this is the fact. You have to agree to this thing. A true dental surgeon is an engineer. He is also an artist. He is also a doctor. Nonetheless, the scope of homeopathic treatment in dental cases is extensive enough to venture. Homeopathy treatment can do a lot in dental cases, but up to a certain level. You can have as many as 97 different remedies and homeopathic therapeutics of toothache in book written by Dr. Samuel Lilienthal. Dr. Samuel Lilienthal's books, Homeopathic Therapeutic, is a world famous book, and in that book we get 97 different remedies, as many as for treatment of toothache. Now on the right hand side, few things have been shown: filling, crowning, root canaling, etc. Now remedies. Toothache for arsenical, swollen bleeding gum, painful to touch, apathy in mouth, picture number 1, grinding of teeth in sleep, intense bad breath from mouth, water tastes bitter, saliva bloody, tongue burning, trembling, stiff, coated white or yellow, neuralgia of tooth feel too long, better from warmth. If you take warm water, you will feel better. Worse at night at 2 p.m. and 2 a.m. and 2 p.m. That is midnight and midday. Both. Not only midnight, but midday also. Subjects anxious, oversensitive, hurried, restless in attitude, despair of recovery, fear of death. These are symptoms covered by arsenic album. Toothache from arnica mold, most appropriate to stop bleeding after extraction of tooth and hastens healing of gum wounds. This is something a bit different. Your tooth has been extracted, bleeding is not stopped naturally or with other medicines. You can take arnica montina. Arnica montina is very effective to stop bleeding. Throbbing toothache with sensation as if tooth were being forced out of socket, drawing, pulling pain in teeth during eating, hard swelling, picture 3, on cheeks with beating and tingling in the gums. And picture 2 is the actually this picture 2, white, tongue coated white in case of arsenic. Toothache for rattan hair, halitosis, mouth gets full of tasteless water, toothache during pregnancy, worse at night, must get up from bed or walk about, teeth seems too long, as if cool air coming from teeth, digging, shooting, jerking pain in lower back teeth, fungoid softening of gums, passive hemorrhage from gums. Picture 1. Toothache from phosphoric acid, toothache in hollow teeth when food gets plucked into caught into them. Teeth turn yellow and feel dull, burning in front teeth during night, dark bleeding from swollen gums recede from teeth, red streak in the middle of tongue, picture number 2, bites tongue involuntarily in sleep, lips dry, cracked, tearing pain in teeth, worse from warmth of bed, from heat, cold. Trouble seems go worse from bad news, disappointed love, grief and chagrin. There is so many different types of small causes where from the toothache may go worse. Toothache for Veramphos, congestive and inflammatory toothache and face ache, always appearing after eating warm food, better from cold drinks. Cheeks are hot. Toothache in Calicarp, toothache alternating with stitching pain in left breast, only while eating. This pertains to ladies only. Mouth slimy, tongue grey white, picture 1. Gums separated from teeth, itching in gums, pyorrhea, aphthous ulcer in mouth with much salivation and halitosis. Toothache for Caliphos, toothache of very nervous, pale, irritable, emotional subjects. Toothache of nervous, pale, irritable, emotional subjects, profuse bleeding from spongy crumb from slight gouge, gums receding, brown covering of teeth, very bad breath from mouth, tongue coated with yellow mustard paste like. This is picture 2. Toothache for cophia or cophia cruda, especially at night after a meal, excessive indescribable pain with tossing, weeping, anxiety. That is patient toss, weep, and in anxious state. Worse from warm drinks, from chewing at night, better from keeping ice or ice water in mouth. Toothache for Hecla lava, abscess of gum, facial neuralgia, headache, dependent or derangement of dental nerves, injury to alveolar process, diseases of the antrum of Highmore. Antrum of Highmore, this antrum of Highmore actually is thus one of the paranasal sinuses. It's called maxillary sinus. This maxillary sinus, this is maxillary sinus, this is maxillary sinus. Its alternative name is antrum of Highmore. Pain in that sinus is treated by Hecla lava. Toothache for Maccar, ailments following wisdom teeth, boring pain at night, tearing, jerking, ulcerative pains, intolerable during rest, so that subjects have to get up from bed and walk in the room with swelling of cheek. Picture 2. Twitching in feet and fingers, teeth feels loose, too long, better from cold drinks immediately. With this, the video ends. Thanks for listening and viewing. If you got anything to say, please write down in the comment section. I will certainly reply.